There is an issue that we have found when presenting or sharing individual case studies and really lived experience. And in global health, we have found quite a strong resistance, in fact, and a kind of dismissal of lived experience of health workers and communities as anecdotal evidence. So in principle, everybody loves to, is really sympathetic to people who are on the receiving end of the harshest effects of climate on health. But when it comes to actually listening and learning, there is that skepticism about the value of lived experience. For you, what is that value? And to a decision maker or funder who says, well, this is all very interesting, all these really nice stories, but what we need is quantitative causal evidence of relationship of climate impacts on health in order to inform policies and actions. What's your response to that decision maker or funder?
Yeah. So thank you very much. So I do come from a strong epidemiology background, and the principles of public health, at least academically, do somehow ingrain it amongst us that that evidence is more skewed towards quantitative assessments rather than mixed methods, which is what we should be looking for. So I would say my first argument to counter this kind of thinking is that adaptation is all about localized and contextually grounded responses. So being dismissive of first line experiences which are described qualitatively, I think that is counterproductive, because whatever else, these examples, these narratives, these qualitative accounts from either healthcare workers or from populations and communities themselves, these are the people and the faces behind the data. So making this information, real life experience, available to policymakers, it definitely, in my experience, adds value to the quantitative data that is presented to them, and they are kind of inclined to make decisions on. And then the second bit is that quantitative data alone is not going to let them design solutions that are going to be accepted at a level that the community would, in case when they are part of that, engaged in that co-design and providing their own perceptions, expressing their needs, and adding that value to those numbers in terms of how we can process actually the quantitative data. And of course, participatory community engagement with frontline case studies is foundational to Save the Children's work.